So we kind of brushed on it a little bit before, but, working in EMS, what did you guys find, like skills, knowledge, all of that you gained from your EMS experience that you feel like has really helped you through nursing or medical school or in your career as a nurse?
Yeah, I feel like for me, kind of go back to what we were saying, really being good at good history taking, being good at doing your assessment. One of the things that I definitely teach when I help teach the classes for EMT is make sure you do a good, thorough head to toe. If you get lost, literally work your way down the body. One thing I teach is always make sure it's good to do more than to do less. Like, I'd always listen to lung sounds because even if they're there for like, they're having abdominal pain, sometimes you can hear things that are wonky. I'm like, oh, maybe that's causing whatever's going on. Or then you just get better listening to lung sounds. Like, if you know what sounds normal or what feels normal for the average person, you know when something's wrong. So going along that, like always making sure you're listening to lung sounds, always making sure you're grabbing a BG for the most part, like when it's necessary, you know what I mean? But as long as you can get good at asking all those questions, even if you have like a baseline set of questions, like in your back pocket of, I'm going to ask every single person these things, then it makes it easier to fill in the blanks, especially for whoever might be handing off report or you finding those incidental things. I remember I had a patient way long ago and it seemed like a very basic BLS call. So I was like, okay, cool. He's just having finger pain. It's 3:00 in the morning. I'll take it, And he gets in the back. I'm talking to him and he's like, yeah, I've been taking 30 pills of Tylenol the past 6 months. Yeah, I've been throwing up blood the past couple months, but it's fine because my arteries are eating themselves. And like, that's normal. And so then you're finding all this lack of understanding. And I think that's the amazing thing that I wish that all nursing students had. I will always advocate that you need to go into EMS before nursing just because it gives you that amazing foundation. You walk into people's homes and they trust you. They expect that you know what you're doing and you're going to try to save their life, whatever's going on. I kind of lost my train of thought, but
I kind of have a point to that though. So I have friends and family who are nurses and, me and my wife being medics, we kind of have different perspectives of the same coin. And we talk about how, nursing is a lot of diagnostic based medicine. We're assessment based medicine. And so the ability to look at something and ask a good question and be like, oh, this is actually answering a lot of my questions. And then talking to my nursing friends and family who are like, I would have never thought to even do that, right? Like that's such an advantage that you've given yourself just having that experience in the background. That's incredible.
Oh yeah. I mean, going back to that story now that I remember what I was talking about. So after I was talking about how they had been taking so much for their pain, they're like, oh yeah, I'm drinking on top of that. So then I'm seeing like, oh, well, you got spots on your hands. Like you're having all this pain, like in your upper right quadrant. Like I think your liver's failing, and being able to find something like that, that's huge. Like that could make a huge difference in somebody's life because they just thought their fingers were hurting, Mm-hmm. So just having a very open mind. I always go into calls or go into whatever your patient's room is and have that expect the unexpected. Even though it's most likely not going to be a unicorn, expect that it's a unicorn. And if it's a horse, great. That's amazing, But as long as you can go in not pigeonholing yourself, then you're not going to necessarily mess up. You know what I mean?
Mm-hmm. One thing that I always I want to get one of those live, laugh, love, type things and have it up in the classroom that says you'll never know abnormal until you know normal. Mm-hmm. That's such a huge thing. I think that EMT students really miss. I don't listen to lung sounds because they're probably just normal.
Yeah.
Well, if you don't know what normal sounds like when you listen to rails, you don't have a frame of reference. That's one of the biggest things I try to imprint on students is you'll never recognize abnormal unless you know what normal is. And kind of touched on it there. So I had to throw one of my things I always throw to students all the time. If you've been my student, you probably got real sick of me saying that because I say it all the time to my students.
Yeah.
How about you, Mo? Anything that you feel like transfers really well?
Yeah, I think the assessment thing is really, really important. Knowing how to ask the right questions and not really just knowing how to word something to a patient, right? For example, you go down your OPQRST and what what does quality really mean? Like, you're not going to tell a patient, like, what is the quality of your pain? They're going to be like, well, I mean, what do you mean by that? Yeah. Like, really just asking things like that. What is like, you know, how to ask a question in a way that makes sense to a patient, like for the average person to kind of understand what you're trying to get at, is super big. And I don't think people really realize that until like they start taking good histories and they're like, oh, I didn't get any of that information because I didn't ask the right questions. Mm-hmm. So knowing how to ask the right questions is super important, and that comes with experience, right? And so being in EMS, like I think that EMS providers in general, whether you're EMT or paramedic, just like Wade was saying, it's like you have to ask the right questions to get the information that you want because you don't have a lot of the diagnostics. And so that really builds in really well. And also I really think just like being able to recognize what is really a life threat and what's not is super, super big, right? Throughout medical school, it was constantly being pushed on us to figure out, like, to really make that like doorway assessment and figure out, is this patient sick or not sick? Like, that's always the first question. And as an EMS professional, you almost always know what that looks like. You know when you're walking into something that is not good versus where, okay, this patient is someone we can kind of stay and play with. And so I think that those are things that are super helpful in EMS that translate really, really well. And I think that there should be some level of that before really going to any professional healthcare school.
Cool.
Yeah, kind of adding on to that, you kind of talked about knowing the correct questions to ask. In nursing school, I know it's definitely an issue. It'd be like, do you have chest pain? And they'll say no. But like, oh, okay, well, I'm having shortness of breath. Like, things have been happening. Making sure you can ask open-ended questions makes a huge difference, because then they'll tell you their life story and you're like, oh, okay, these things are adding up. But had I just asked one simple yes or no question, you wouldn't be getting that answer. Mm-hmm. And then even talking about how, you know, like if it's a life threat, there's a lot of distracting injuries. Like if they're actively bleeding, but that's not their issue, their airway's the issue, or things like that, being able to address the life threat first makes you so much better once you get into hospital or you get more experienced as an EMT. So, yeah.
Like learning the skill to prioritize, essentially,
Exactly.
because that's so important for what we do, because we're so limited.
ABCs.
Something we have to learn.
Mm-hmm.
Yeah.
And then the ability to like reword questions was something that like it took me a long time to figure out, of like, you know, can you describe your pain for me? And they're like, I don't. And then you give them the sharp or dull. Well, with my two options, I'm going to go with sharp, right? Mm-hmm. Like, how can you reword that to? And one of the ones I used to use, like, if you were to do it to me, what would you do, right? Like, if they're really not grasping it, like that's such an assessment based skill. Yeah, you can steal that.
I will.
Trademarked.
So we've talked kind of about the good things EMS wise, but you guys now being in hospital and having seen kind of the long term, like, are there any things that you've noted that, like, we really suck at that as EMS providers, right? Like, are there any things that you know, if for me and Wade haven't done this for years and years, is there anything like, hey, now that I know this because Mo told me, I should be better at these things, right? Anything you guys want to throw out there that you've seen in your experience?
I will say that, like, this is not so much, I don't know if this is directly answering your question, but it is an interesting thought that kind of comes to mind with that, is I feel like a lot of EMS professionals, and I don't know if it's the same, maybe just because I'm from Chicago, there's hospitals everywhere, it may change this, so I don't know if this is applicable across the country, but I will say that what I've noticed is a lot of people almost downplay their worth as an EMS professional and what they can do. And it's like, the amount of times that I've just heard, let's just BLS it. Like, let's just BLS it, and they can take it to the hospital, and they'll do all that at the hospital. Why are we going to do this pre-hospital? And it kind of bums me out, because ultimately, like, you are a professional. You have a license. Like, you are capable of doing so many things. There's no reason to like downplay what you're capable of, right? Take the time to like do the things that are important for that patient. Don't just be like, well, you know what, the hospital's 5 minutes away. Like, no, they'll handle it. And so that's something that I feel like EMS can do better, is like really finding their worth, because EMS is constantly evolving and it's constantly becoming better. And, the reality is EMS has only been around for 50, 60, 70 years, whatever it is. Like, it's not that old in retrospect. Like, you look at it and you're like, wow, EMS is a very young profession. We're continuing to grow. We're continuing to find new ways to make EMS amazing. And so, like, don't ever just downplay what your worth is in EMS. And I feel like that happens a lot.
I've definitely heard that before. Some providers like, we'll just the hospital do it. My big gripe is when it's like, I'm not getting IV. The nurse is going to do that when we get there. Yeah. It's like, it takes us less than a minute. Just do the dang thing, and we can keep moving forward. Make their life easy. Make our life easy.
And they will appreciate it too. I'm sure. Like, if there's a line started for you, and you're like, oh, sweet, yes, yeah.
How about you, Nikki? Anything comes to mind?
I'd say like this all starts as you're still a brand new EMT student. You're in a very controlled environment. Everything's very safe. Treat this as if this is real life, because I mean, I definitely was fallen victim to this. We're like, oh, you're getting comfortable. Oh, this is a game. This isn't a game. Like, this is somebody's life when you really think about it.
This isn't a game. I just like imagine you standing over like a brand new EMT student.
Stop it.
This
Take
isn't
it
a
seriously.
game. Yeah.
But I mean, when you really put it into perspective, like you're training for real life. Yeah. This isn't a joke. And I know you can start young, but like if you can take this seriously and recognize that this is somebody's life that's in your hands, this is somebody's loved one. And I know we say it quite a bit in nursing school, and I try to reinforce this in EMT classes, but treat them as if this is your family member. There's a lot of people who are very difficult to work with. Either they're like super upset or they're going to get angry with you. It's not because they're angry with you. They're angry at their situation and they're taking it out on you.
That's so big.
Which is like, it's not okay, but on the same token, you need to understand that this isn't your issue and you're going to still treat them with respect. Just because they're being mean to you doesn't mean you need to be mean back. And I think that's definitely an issue of when we get those frequent flyers, if they're going to continuously be those type of people who are like, oh, not this person again. And you go in with that mentality, they're going to still keep calling. If you are mean to them, it's just going to make it harder every time you go and see them. I think another thing is I've definitely fallen victim to this one as well, but we have to do continuous trainings all the time. If you're going to keep clicking through it and not take it seriously, you're not going to learn anything. I think, especially in the EMS profession, you need to continue and try to build your skills. Try to go out and learn more, even if it's just, oh, I found something on TikTok, because there's a lot of useful things. I love TikTok, but
In my life, yes.
as long as you can keep yourself, again, with the inquisitive mind, or ask your partners, like, hey, like, what's an interesting call you had? What did you learn from this? Like, what else can you teach me? As long as you just keep it going, I think you're setting yourself up for success.
I think you said it well. Like, there's always a perspective, and I noticed this through EMT school, I noticed this through medic school, is there's always these people who don't want to take it seriously because it's like uncool or cringy to care about what you're, the stupid
That's
training.
such an EMS mentality.
Yeah, it's like, oh,
yes.
CE, it's another 3 hours I have to do once a month. This is garbage. I'm just going to click through. It's like a little bit of buy-in goes a long way, because end of the day, you're not hurting anyone else besides your future patients.
Yeah.
Right.
Yeah.
And like, I've had several calls off the top of my head that like, I did a training. I was like, I'm probably never going to see that. And literally the next day I was like, well, would you look at that? That's a very real thing. It's just buy in. It's not hard. Now, there's lines to it. We're not asking you to be like a Ricky Rescue and drive around with your Halligan, but like, buy in when you're at work and take it seriously. It goes a long way for your own sanity more than anything.
Just care about what you're doing. Like,
Right.
Yeah.
have some respect for the profession and what we get to do, because what we do is not something most people get to do. Like you were saying earlier, right? Like we walk into people's houses on their worst day, they automatically respect us and trust us because of the badge that we wear and the letters behind our name, kind of a thing. And like and it can be fatiguing. I know personally me fatigue, like the way I put it, right, is we are everyone's grown-ups, right? I have a couple kids at home, and if there's a problem, no matter what it is, mom and dad are going to fix it. We're going to ask mom and dad, no matter what it is, right? And just the same in life, when you grow up, you realize like they were just kind of faking it till you make it. We are the same in EMS and healthcare, I'm sure, in general too. But we need to respect that they are calling us because there's a problem and they don't know what else to do. And so maybe it is something stupid like grandma can't find the controller and she wants to put on Jerry Springer, right? Because a lot of us have been on calls like that.
Oh, yeah.
At the end of the day, though, like we are just kind of that last whatever, I don't know how to put this, like that, that last catch-all of society to help them solve their problems, which can be very fatiguing, but it is there's something you need to definitely respect, that's an honorable position that we have that most people don't.
I don't think I rationalized that until I had an FTO one time. It was after a call, we're talking about it, and he's like, this is a weird profession, because how many jobs would you walk into someone's door and they hand you their sick child and they're like, go.
Yeah.
That doesn't happen in real life, right? Like, you'll never find me doing that to anybody, And so it's just take it seriously. Like, it's there for a reason, all the training.
And the reality is too, like, we kind of going off of both of your points too a little bit earlier, is like there's our frequent flyers, and EMS is notorious for like really hating on their frequent flyers. The reality is there's a frequent flyer for a reason. There's something happening on the back end that is happening that's causing them to be this frequent flyer, right? A lot of our frequent flyers, maybe they're living without a house, maybe they don't have food security, maybe whatever the case is. And at that point, for them, the one thing that worked for them was to be able to call EMS to get them to a hospital, to get them into a bed where they can eat and have whatever. And like, sure, it can get fatiguing for EMS, and I understand that, but just remember and try to like really put yourself in that situation and try to remember like what is causing that situation to happen and what's causing that situation to arise. And don't just be like, oh, it's this person again. Like, here we go again. Really try to take the time to remember that like this is another human being. This is a person. This could be your family member or you one day. A lot of these people it's so sad. I talk to so many people, and like really once it comes down to it, you start to realize like they're people just like you and I, right? They had a full career or whatever the case may be, and something happened to put them in the position that they're at, and any one of us can be in that same position. And like never forget that, and never let yourself just become, just, oh, this is another frequent flyer, or this is whatever situation this is. This is another human being. Like, you hold a license that people respect to like care for human life, and you should take that with a huge honor and kind of pull that forward as you go on through your career.
Compassion goes a long way. Really
Yeah,
does.
especially towards not getting burnout, right? Like having that compassion really makes a difference for burnout, because you can be burnt out by those, this whatever homeless person or whatever's going on, right? You can get really burnt out by that. But if you start to look at them as a person, like, I know this address, I know this time of day, whatever that's being called, but like, hey, I'm going to go like, there's a frequent flyer we've been on that like would sing to you, you know what I mean? Like, and you'd make it fun, be like, hey, what's up, person, right? Like, how's it going? Hey, man, like, hey, you've been listening to some Michael Jackson lately? Hit us with some whatever, right? Like, if you humanized them, and these people that you see all the time that can be frustrating, you make that connection with them as people, you're going to be there either way, right? Like, that call is going to happen.
It's going to happen,
right?
Yeah.
But if you can make that human connection, then instead of it being an annoyance, and it's like, oh, hey, I'm going to hang out with this guy for 10 minutes and see what they need, maybe help them out a little bit, get some food or whatever they need, and maybe we'll see them again later, right? But having that bad mentality is going to burn you out real fast for those kind of patients.
I had a partner who I loved to death, and if he listens to this, he'll know exactly who he is. He and I were so we love each other to death outside of like the ambulance. But when we were on the ambulance together, we were total opposites. This person was very much like the type of person that was like, let's just get him to the hospital. And like, and I was always like, let's just do whatever we can here before we take them. And so I remember we there was a call where there was this patient who was a frequent flyer. We've had them several times. And ultimately, he was homeless and needed a place to go, and it's cold outside. And like, what would anyone else do in that situation? And so it was always a go-to, like, I have chest pain, right? Because like that's like the one thing that's going to get people riled up, and you have to do the EKG and get them to the hospital, and you have to rule things out. But this patient, like I ended up talking to him and really getting down to the nitty-gritty of just like, understanding where he was at and where he needed to go and like what he needed for himself. He finally did admit to me that he was like, look, man, I really just need a place to stay and I need some food. And at that point we said, all right, let's figure this out without having to take you to the hospital. We got, the social work involved, and we had police come onto the scene, and like we ended up working it out where we were able to like call around, figure out what shelter was taking patients at that time, where we can get them in. We had this whole coordinated effort, and we were on scene for like 40 minutes, right? And like my partner was like, dude, let's just go get him to the hospital. What's going to happen? They're going to get him into the ER, and it's going to be the same thing. That patient's that hospital bed is now going to be taken by this patient, who's ultimately going to need the care anyways. They're going to need the same outcome anyways. And we can take care of that right here. And like skipping the step of transporting them to the hospital and just dumping our problem on someone else. And ultimately, we got everybody involved. We got the shelter that needed to go. The police was willing to take him over there, and everything worked out in the end. But it took some time, right? And it's like, if you just remember like, hey, this is what we need to do, like ultimately you can do a lot in the pre-hospital setting.
And long term, if you're frustrated by this frequent flyer, that's how we stop them from calling over and over, because they have a need that's not being met. Right? Like, though the mentality I have is that those patients, it's not a failing of them. That's not why I'm there. It's a failing of society. right, for whatever reason. And if we can try to help fix that thing, that whatever failing of society has gotten them to that point, and obviously there is some personal accountability for people, right? But, if we can help fix that, then maybe they're not going to need us anymore. We don't need to be that catch-all of society. They figured out the other resources we can help get them there.
For sure.
How about clinically? Now that you guys work at kind of a higher scope or different area, anything clinically that you were like, going through med school, you're like, wow, we do not understand this as EMTs and paramedics, and it's could be detrimental to our patients. Or you kind of same thing, especially you're like neuro ICU, right? If I remember
No,
correctly?
I'm medical and surgical.
Medical,
So we get
surgical,
everything. It's a modge podge.
So
But
either way, right? Like, what are those things like this was not taught very well, and it really should be at the EMT or medic level?
I'd say I know a big thing that they try to teach in EMT schools is like knowing your different types of shock, but every single one is pretty different. So like really being able to see what's going on with your patient is going to affect your plan of care. Like, are they going septic? Is their temperature elevated? What's their heart rate at? Is that normal? How does that compare to their blood pressure? If you can kind of understand what's compensated versus decompensated and try to find like the root of the issue, like you don't have to be like, that is distributive shock rate, but like as long as you can understand the premise behind it, like oftentimes even in hospital, we get confused cardiogenic shock versus septic shock all the time. And then we just overload everybody. But like, do they truly need fluid? What is actually going on with our patients? I feel like makes a huge difference. And it starts in the beginning, because a lot of times moving on to that fact of like, okay, we get our call, the call type says it's shortness of breath. Now we're pigeonholing ourselves into like, okay, well, this is probably just an asthma attack based on the call notes. But then you get there and it's like, it's anaphylaxis, or it's they're having pulmonary edema because they're in cardiogenic shock from their heart failure. So like, let's dig deeper. As long as we can understand basics, I think that makes a huge difference. And a lot of times in a hospital, we miss that too.
I will say, I think like a lot of times, like we're given, drugs on our rig that we may not necessarily really know what they're doing and how they're working, and we're just pushing them. And it can ultimately be really scary if we once you start to learn about like more deeply about like how these things work and like their effects on the body and what can happen, you're like, oh man, we were just giving this kind of willy-nilly around, it's like, well, there could be some issues there. I think, one of the big things that comes to mind is paralytics and sedatives, where, we as paramedics, like we always just want to like open up that scope more. And we're like, we really want those drugs on our rig. And, I think over here, like you guys primarily do have access to them. In Chicago, like you don't have access to paralytics for the most part. That was a special case. I had my own little lockbox. I was approved. I was like the only one on my fire department that was approved to have it. But that was because of my critical care background. But normally like you didn't have access to that. And like, I think as I learn more and more about how these drugs like interact with the body and what they can cause and how it like can impact things, I'm like, maybe we shouldn't be like just gung-ho about like RSIing everybody and putting them down. Like we should really be thinking about these things before we do them, because they can have really, really big impacts down the road. So that's one thing that comes to mind. But in general, a lot of our drugs, we just try to keep like putting more drugs on our rig. But genuinely, like we don't have the time in paramedic school to learn how those drugs impact the body. And so that can be kind of difficult sometimes.
That kind of brings up a point. One of the big scary meds, I mean, I guess it's not a scary med, but it was scary in the sense that like EMS, we just slam everything. Like you don't have the time. Let's just push it. Like Zofran on Danzatron that we use for nausea. That's one of the meds that in nursing school, they ingrain into our brain. Push it slow. You're going to widen your QTC, which is like part of your...
That was the exact drug I was
like,
thinking about when we were talking about this.
We shouldn't be slamming this. Like, it's just when you think about what's actually going on, or a lot of times I've had calls where the paramedic's like, yeah, they're really agitated, but I just don't want to deal with that. And now we're going to be pushing Versed. Like, do they really need that? Now you're going to be making them obtunded, and now they're not responsive by the time they get to the hospital. You're just masking whatever issue's going on. So again, yeah, you brought up a great point with all those meds.
So farm knowledge is a bit lacking at the EMS level.
Yeah, it is really hard. I think like you don't have the time to really like learn all these things, but ultimately like you have these drugs that can have really big impacts on someone. So like farm knowledge can be really lacking in EMS sometimes.
Yeah. Yeah. We do carry a lot for what the level of knowledge and training we have.
And it's all necessary, right? It's just a matter of like, if you're going to be pushing something, you should know what you're pushing. And if you're not taught in paramedic school, then you should be learning it on your own time. Like if you're going to push that into someone's body, like you need to know how it works.
Yeah.
There's some meds that we went over in medic school, like, sodium bicarb and calcium. It's like, I know my 3 reasons I would use this, but it's tough because we're not trained, lab values. I ask like, oh, what's their calcium? And they toss a number and I'm like, that means nothing to me. I'm going to give it anyway.
Why did I even ask that question? Because I don't know what you're telling me.
And like, yeah, you're not wrong. There are some meds that even through my career, I was like, I know, like I've seen people push this for this situation, but it makes me, that's medical control calling every time, but it's like, it's tricky, especially like thinking like cardiac issues that come from both of those,
Yeah.
I think another thing is like knowing that you can change. I know there's a lot of, I'm going to say crusty dusty paramedics, like they're set in their ways. Like I've done this for 30 plus years. This is how I'm always going to do it. Like I'm just thinking about like ACLS, like a lot of the things we'll push lidocaine or we'll push amio, like get your bolus in. But amio stays in your body like 90 plus days. Do we really want to be pushing that? Like if we can try other things within our scope of practice, or things like that where we're not continuing our education. Like I just went to a stroke conference and that was amazing all in itself. But I was learning that if you can lay their head abed flat after a stroke, like once you pick them up, it can impact their NIH, was like the scoring that we use in hospital to see their deficits. It can impact their NIH score upwards of 5 points. That's a huge difference. That's the difference.
5 points is huge on an NIH scale.
Yeah, that's like all of your extremities going flaccid type deal. So if you can take that into account and like really understand what's going on, I'd say doing your continuing education, like MCRIT is an amazing podcast that I continuously listen to. Like as long as you can keep it going.
Yeah, and that's one of those things that's hard too, I think, for especially newer providers of like where to go for this. It's not necessarily a lack of wanting to be better about these things. It's just like it's hard to find this information, right? Like even as EMS instructors and educators, right? Like medicine moves so fast, and to be able to keep up with it would be kind of a job on its own, right? And making sure it's reliable resources that you're pulling from and all that, it can be really difficult. But yeah, I definitely agree. We kind of talked about it before. That's a big failing of EMS of CE is like, well, I just got to do it for my registry or for my state, and there I think there is a failing of EMS education systems, maybe at the different departments or wherever, of not finding stuff that's actually good, right? Like we had one training at where we worked on drowning that like I remember. Great. Like that was like water cooler talk after, like it was so well put together, such good information, stuff I had never heard before, like it was a big thing. Like the EMS education, and I say this as an EMS educator, definitely has some room for improvement that there should be, especially for the higher levels and that further knowledge.
With like the rinse and repeat trainings, like it's January, it looks like we're going over cold emergencies again, and it's like, yeah, we understand that's part of it, but like kind of diversify it a little bit, like change it up, because we know what this field changes, because the second you get complacent, it's the second you're behind.
Yeah.
There's a lot of really, really good resources for physicians. Like I know like in medical school, like I've been exposed to so many incredible resources. But like, as I think about it, like I don't really know resources like that are really available for EMS, like to that level.
Yeah, and that's kind of Wade's looking up at the band, and that was the reason for us starting this, right? Like our lane is kind of basic EMT stuff, but having been through it, I was like, there's not a lot for EMTs that want to refresh knowledge or anything, and like that's kind of what we're about and what we're a gap we're trying to fill a little bit. There's not a lot for EMS, especially because you can find like flight medic specific stuff or critical care. There's a lot of that out there. Yeah. But at the EMT level, it's really hard if you want to be a good EMT to find resources. At least that was my experience.
Far more basics than there are critical care medics.
It's true. Yeah.
Yeah. And it's the basis of everything EMS wise is basic EMTs, and they're just kind of forgotten a little bit. Yeah. Changing lanes, we're getting close on time, so a couple other questions. We'll change lanes a little bit. Anybody listening to this maybe that wants to go down the paths you guys have, any advice that you would give to anybody like looking to go EMS medical school or medical school in general, nursing school, anything like that?
I will say, like, I think the biggest thing is if you want to do something, go for it. Don't let yourself fall back and say like, oh, this is going to be too difficult. This is going to be too long, or I'm too old, or whatever the case is. If you want to do something, you should absolutely do it, because you could do anything that you put your mind to. And the only person, like we said before, like the only person that's going to stop you from accomplishing anything is yourself. And so, we have, like in my class, again, I have people who are like in their 30s, 40s. I started at 27. If you want to do it, it's never too late. If you find yourself, starting off really right from the beginning, EMT, and want to go right into medical school, great. If you want to take some time and like explore the EMS realm, do it, right? Like whatever you feel like is going to be beneficial for you. I say, take advantage of it, whatever your heart's telling you. And if you want to do something, just do it. Just follow your passion, follow your dream, and don't let anything, stop you.
Absolutely. I think adding on to that, like with the whole you're never too old. I mean, it's so easy for us to talk about it as we're in our 20s, you know what I mean? But
well, I'm in my 30s now.
well, it's okay. But anyways, like you're never too old. Like in my nursing program, I had people that were in their late 50s. It's never too late. There's so many different avenues. If this is like what your goal is, keep trying.
Cool.
Yeah, brother.
Yeah, you got any? I mean, Wade,
No,
you're here too. I keep not asking questions of you.
No, I got nothing. No, I got
You're
nothing.
just here for the pretty face.
Yeah.
Essentially.
I'm the color commentary.
So last one I had for you guys, hopefully can be kind of fun. If you had Mo and Nikki first day of EMT school sitting in front of you right now, what would you say to them? Anything that you would tell them?
Ooh, that's a good question.
That's a really good question. I think the biggest thing for me is I had so much fear. Like, don't be scared. You're never going to know the answer. Like going along the lines of like, I really try to memorize the book because I try to be prepared for anything. Like you're inciting more fear by learning that way. And it's okay to not know the answer. You're always going to have resources. And worst case scenario, if you don't, you've got Dr. Google. Like there's definitely been calls where I'm like, I don't really know what's going on. Let's type in symptoms. Like, let's see what we can finagle with whatever's going on. I guess another thing that I would potentially tell myself is to give myself grace. Be patient with yourself. It's okay. You're a person. Feel those emotions. I think that's another thing that we could potentially improve on in EMS is I remember one of my very first calls where somebody died. I was coming out of the ER and I'm bawling and everyone's like, are you okay? And what are you going to say? No, I'm not okay. And I was like, no, I'm fine. But like being able to really debrief what's going on and to take some time for yourself is huge. I was so lucky that somebody from the county had texted me and they're like, hey, like that was really tough. Like I know that really hurt. Like, how are you doing? Can I do anything for you? So even if you're just that person that's supporting somebody else, that can mean a lot. So I think just being able to be a person, recognize that you're not asking all these questions because this person is like somebody you're trying to fit into a box. Have a real, genuine conversation with somebody. You're going to get a long way with just being real.
Cool. Mo, anything?
Yeah, I would say if I could, tell myself from before is just like never look at any mountains being too high. I think that I was always scared to go on to the next step or the next level because I didn't think that I was good enough, and I didn't think that I had the worst imposter syndrome. And I was like, I'm just not good enough. I'm good at what I'm doing now, and I should just stay there. And I allowed myself to kind of be stuck in that status quo for too long. And if I could tell myself back then is like, just never see any mountain is too high. You can overcome anything. And truly, once you do that, the world kind of opens up, and the world is your oyster, and you can do whatever you want.
Cool. How about you, Wade? Anything that you would tell baby Wade?
I mean, don't be scared is a good one. Because that fear set is so huge of like, especially when it's like, the realization of like, this is for real. And this is like people's lives that don't be scared and embrace the process, right? There's going to be moments where it sucks and there's going to be moments where it's great. And you're going to have to find balance in all of them.
Yeah. Anything that you would tell your EMT instructor if you could meet him today?
Yeah, he should have lectured a little better. He really-
For you that don't know, I was Wade's EMT instructor like 8 years ago or something.
Yeah.
So
I don't even know. I can't remember that far ago. It's too long.
Yeah, that's a lot of sleepless nights working
Yeah.
on an ambulance for sure. That kind of destroys our memories.
Giving up childhood birthday party memories so I can remember medic school. Yeah.
Cool. Well, hey, I really appreciate you guys being here. This is really cool. Cool, different perspective of people than we usually have here. Still, kind of similar lanes. I think we're all still kind of similar-minded people, but getting a little bit of extra little sprinkles on top is pretty cool. So yeah, any closing thoughts from you, Wade?
No, it was great. I'm happy to have you guys on here. It was cool to kind of separate. One, I'm just sick of listening to Chris all the time, but like it was cool,
Fair.
like diversifying it up, and seeing the different realms. It's cool to see where you guys have landed, knowing that we all started from a similar launch pad. That's really neat.
Yeah. I'm just proud of you guys. Like realistically, it sounds cheesy, but it's like I said, you're one of our first advanced students, and like seeing you get through med school and like matching where you want to match. It's really cool. It's really cool to sit on the sidelines and be proud dads over here as you guys are doing great things. I know.
Yeah. I really appreciate you having us on here. It's really, really cool opportunity, and like genuinely so proud of you guys. Like when I joined the IMA family as an instructor, on the ACLS and BLS side a few years ago, I didn't realize like how awesome this place was and how amazing like the instructors here are. And so like as I continue on, like I always talk about IMA, like IMA is really, really great. And so it's truly an honor to be able to like be with you guys during med school and for like this to all to kind of come full circle and now to be done. And I just really appreciate being here.
Cool. Yeah. Appreciate it, man. Well, cool. Thanks, guys. Like I said, appreciate you guys being here. Thanks for listening, watching, whatever you're doing as always. Hit subscribe, hit like. If you got any other questions or, maybe some other specialties that we can try to reach out to. Nikki especially is a good resource locally for, we'll get L&D in here someday. We'll get somebody from L&D. Anything like that you'd like us to kind of cover, we'd be happy to do so. Thanks for being here. We'll see you guys later.